so now we're going to show you how to set up the Swan-Ganz catheter. So that we have two different kits here. This one we're going to be showing you today is the CCO combo one. This is the one that's going to give you the cardiac output. So we have our catheter here. We have two sides when you're setting it up. This bottom half is going to be the non-sterile side. This top half is the sterile side. So when we open it, we're going to see the arrow right here. We're going to pull on that arrow. Open this side only. Expose this half. Okay. So we have our transducer cords here that we're going to connect to our turbo transducer that we have set up. We have A-line, CVP, and PA. Okay, so we have our PA transducer. We'll connect it to the yellow cord, like that. We have our CVP transducer. We'll connect it to the blue one, just like that. Then we have this white cord. We'll put our stopcock to it. And then connect the flush to the end of that. Just like that. And then you'll see the kit comes with a syringe inside. We'll take that syringe. This is a special syringe that only allows a certain amount of air to go into the balloon. So only use a syringe that comes in the kit. Don't use another 3cc syringe from outside. Just only use the one in the kit. And we'll connect it to this red port right here. Okay. Then these three cords. We have our cord set up. Just connect these to the Swan, to the Edwards machine. Okay. Now that we're all plugged in, we can go ahead and show you how to set it up to the monitor. So once all your stuff is connected to the catheter, all the cords are connected, you can go to the monitor and you'll see this screen. You type in all the patient information first and it'll take you to this screen. So we have minimally invasive and invasive. This one will be for your flow track. Arterial line, this would be for your Swan-Ganz catheter. So we'll do invasive, press that. And then we can go to our settings. And we go to venous oximetry calibration on the top right. So in vitro calibration means outside of the body when you're calibrating it, and in vivo means the catheter is inside the patient. So since we don't have a patient, we do in vitro, and you can press calibrate. And it'll give you this pop-up screen. The calibration is okay, and you can insert the catheter. And you'll press start when it's inserted. Okay, so you see down here we have all of our parameters or our monitoring. So you can go ahead if you want to change it, press on it, go select parameter. You can change it to cardiac output on the top. You'll get your cardiac output. You have your stroke volume. If you want your cardiac index, you can get that. And then you have your super oximetry on the side right here. You have your A1 and A2. Be sure whenever you're setting that up that you do the same on both, because the cord is connected to either A or B, so to see which one it's connected to. So A left and A right. Okay, and you have your SpO2 right there. Another thing you want to have ready before you start to insert the catheter in the patient is make sure you have your A-line, your pulmonary artery pressure, and your CVP showing on the monitor, especially the pulmonary artery pressure, because that's how the provider tells where the catheter is when they're inserting it in the heart. Okay, so now we're going to show you how to insert the Swan catheter. So we place our MAC central line in the patient already, so now we're ready to insert the catheter. So you're going to want to have an assistant grab the kit and open it for you sterilely. And then you'll grab the catheter itself. Keep in mind sterility. Okay. So we're going to be testing out the balloon, and we're going to be flushing all the lines to make sure it's good to go. So first we'll flush the CVP and PA. Okay, good. You see it dripping. All right. Now the PA. Okay, good. And then we'll test the balloon.
VIP?
Yep.
Alright.
All right, good. All right, so we see it stays, and then we'll see it deflate. Okay, good. Okay, so everything's tested, so we know this is a good catheter. So we're gonna look at the catheter, we see the markings. This is 10 centimeter, 20 centimeter, 30, 40, 50. And before you insert the catheter inside the patient, you wanna make sure you have this sheath cover on. So put it in, slide it up on the catheter. It's good to keep it sterile. Okay, we'll slide that all the way up. Okay. And then you can go ahead and insert the catheter. Keep in mind where you're at, look at the waveform. Okay, so once you're good with where the catheter is placed, the location of it, you can go ahead and slide this cover. You want to tighten it right here. Okay, go ahead and slide that down. Connect it. Okay, and this little sticker helps keep the cap in place right here. Okay, good to go.